So based on the results of the recovery trial, which is really the best evidence we have, it would be 6 milligrams of dexamethasone IV or PO for 10 days. And so I would always recommend the evidence-based dose. I think early on in the pandemic, before recovery was published, there were a variety of different doses out there, but a lot of our providers have really streamlined this, and this is the dose that we have in our order sets.
So you're saying 6 milligrams for 10 days?
Yes, absolutely.
All right. So what about the antivirals? What about the immune modulators?
So I think that this is still a debated topic. I think remdesivir, the data really isn't that excellent to support its use. I think if you have patients who are hospitalized and requiring supplemental oxygen, who are early on in their course, so within 7 days of symptom onset, I think it's reasonable to consider the use of remdesivir, just knowing that it's really not going to have an impact on mortality and it may reduce duration of symptoms and clinical course. But other than that, it's really not going to provide a lot of benefit, and it really shouldn't be recommended for our patients who are hospitalized and require invasive mechanical ventilation or ECMO. And then tocilizumab, has recently received a lot of press. We had our big clinical trial that came out about that. And really, we save this agent for patients who are hospitalized with rapidly increasing oxygen needs and evidence of systemic inflammation. So this would be like your patient who's in the ED who rapidly progresses to ARDS or respiratory failure, those patients who get intubated or require ECMO within the first 48 hours. So it's really early on from symptom onset that we would consider this agent. It's kind of a niche therapy, but once again, not a big mortality benefit. So really Decadron is your workhorse here.